Okay, we are live.
Yeah. Good evening, everyone. I welcome all of you to this masterclass. So this is a very, very important and a very basic class where all the basic information about the energy sources which are different between the harmonic and Shearer will be discussed. So this query, at least we receive almost like 4 to 5 times in a week as to what is the setting of the Shearer and why sir doesn't use harmonic, or what is superior about harmonic which is not there in Shearer. So today's class will just brainstorm the whole lot of debates and questions that many people have asked so far. So I request Dr. Jay to start his presentation, and then I'll ask a few relevant basic questions.
Okay. So very quickly, I am going to just in a less than 1 minute's time. Okay, I'm going to show I'm going to show the screen. I hope my screen is getting shared. Just see. Is it getting shared?
No. Yeah. Now,
Yeah.
yeah.
Okay. So just have a look at this, everybody, because this is what is important. Remember, whenever you are talking of any form of electrosurgery, okay, whatever form of electrosurgery we may try to think, talk, whatever it is, okay, we are never going to be talking of bipolar and monopolar. All right, that is different. Bipolar is basically when you have two poles. Monopolar is when there is a single pole, and in that single pole you have a cautery plate and a pencil. So that is separate. Okay, what is important for you to understand is these two things: what is cutting and what is coagulation. Okay, what is cutting, what is coagulation, and then I will just add one thing: what is sealing. Okay, so just remember, cutting current, this is simple, ekdam first standard physics. Cutting current is a very straightforward continuous waveform. Okay, coagulation current, if you see, is in pulses but with a high amplitude, and sealing current is high amplitude, sometimes continuous, sometimes blend, sometimes again continuous. Just remember only this much difference. Apart from this, please don't remember anything at all. Only this much difference you are supposed to remember in this entire electrosurgical units. Bipolar is when two poles are together, so there is no leakage of current. Monopolar is when current passes through the body and goes out through the patient plate. Bas, that's it. Beyond this, don't try to understand anything. Okay. I will switch the system and go straight to the camera. When I go to the camera, you will be able to see my the entire cautery. Okay. Can you see the cautery?
Yes.
Can everybody see the cautery? Okay. So see, even the cautery is very intelligent. On the cautery also, they have not mentioned monopolar, bipolar. They have only mentioned cutting current. They have mentioned coagulating current. Correct? They don't end up mentioning bipolar, monopolar like that on any of the majority of the cauteries. Okay. What is important for us to understand is this thing. See, in the cautery, if you go little further, you will have current like pure cutting current, blended current, blend 1, blend 2, endocut, and in coagulation also you will have spray, force, fulgurate, desiccate. These are all different types of current settings which are available for coagulation as well as for cutting. All right, but these two are the main waveforms on what everything is going to be reliant upon. And finally, you have the bipolar and seal mode. And see, on the seal mode, if you see that blue thing, no, on the seal mode here, my finger you can see, on the seal mode we have connected the Shearer. This is the Shearer. I've got the Shearer also today at home. Wait, where is it? I'm unable to show that. Yeah, this is the Shearer. See this? The whole thing is connected to that. And if you see the foot pedal has two things. One is the bipolar and one is the seal. Okay, so we are going to be using the Shearer almost always on the seal mode all the time. Okay, now after having understood only this much, what is it that you need to understand about using the Shearer? Okay, Shearer is basically a bipolar current. Just remember that. That is the most important thing in this entire lecture. If you see the Shearer, can you see the Shearer nicely here? I'm showing it in front of my glasses. Okay, if you see, This is a bipolar device. So what does it have? It has one pole and the other pole. So the current passes from one pole to the other pole. Very simple. What comes in between these two is the tissue. Let's say my finger is the tissue. It has come in between these two. So my current will pass from one pole, go to the other pole. So all the tissue which is present in between will face the music of this current, right? On top of it, what have we done? We have designed the Shearer blade in such a manner that it is an inverted pyramid. Can you see that? This inverted pyramid allows you to focus the current at one particular point. So what does it do? It is a bipolar current. It's a ceiling current basically. So it is generating a lot of wattage, and it is going to allow you to cut the tissue. So the minute this current, despite being bipolar in waveform, it passes through the tissue, it allows you to cut through that tissue, which is why Shearer is excellent when you want to do dissection and cutting. So if anybody of you watched today's surgery, the live surgery which we did, please try and understand Shearer is going to work beautifully once you have dissected and skeletonized the tissue. If you have a bunch of tissue, large amount of tissue which is present in between these blades, then it is going to cause lateral thermal spread. If you have hardly any tissue which is going to come in between this, it is not going to cause that lateral thermal spread. Okay, one more thing. Many people ask that, okay, when we are using this, how we are ideally supposed to use, what are we supposed to do in our routine life situations? So if you look at the camera here, I'm just trying to get the pedal here. See, this is the foot pedal. Just before your tissue, just before this thing, okay, just before it comes inside the contact of the tissue and just before it grasps, that is when you press onto the seal. You can hear the cautery. I'm not holding any tissue because the only tissue currently available is my finger and I can't burn it off. Okay. But then that is what is the principle of using this particular current. You need to understand this. People have made this mistake commonly. What people will normally end up doing is that they will first grasp the tissue with the Shearer. After the tissue is grasped, then they will press onto the pedal. Then when they press onto the pedal, they will say, oh, there is so much lateral thermal spread. Not the correct mechanism of using the Shearer. Correct mechanism is just before this blade is about to be closed. Here, press the pedal. You can see that there is a small distance which is remaining in between the two blades when it is just about to be closed. This causes the current to spark. And this sparking of the current literally zoops through that tissue. Okay, it literally cuts through that tissue without causing any lateral thermal spread. Which is why we tell that when you use this current, you require a good amount of learning curve. This is your learning curve. When to press the pedal. This is your learning curve in your bipolar Shearer. This incidentally does not happen with the harmonic, because in harmonic, first you hold the tissue in between and then it is working on mechanical Shearers. Okay, so it is the crystal is going to vibrate close to 40-50,000 times every second, and that heat generated out of vibration is going to allow you to desiccate through that tissue. That is a different mechanism of action. If the tissue has not been grasped very correctly in between, all right, it will not be able to desiccate. Shearer does not work on that type of principle, and we are used to grasping things. In our gynecological training, we are asked to first cut, then clamp, and then ligate. So we have this habit of going and clamping everything what we see. Understanding this is not how the Shearer is to be used, which is why as practicing gynacs, we find it little difficult to use the Shearer. Okay. Just remember one more basic principle of any form of electrosurgery or any form of electricity. Why electrosurgery? If the surface area through which the current is spreading is large, no, it will always end up coagulating more and cutting less. Okay, that is why your bipolar, the Bissinger bipolar, which has beautiful serrations, is going to allow you to coagulate through a large surface area with the same current. Understanding? The Shearer will not allow you to do that. The Shearer has very, very thin blades. Okay. So many people have asked me what is the setting of the Shearer. So the setting which I have shown on this machine, as you are aware, is L3. See this. I have shown setting at L3. Correct? This is 3. I can make it 4. I can make it 5. I can make it 6, 7, 8, 9, 10, whatever. So just remember, somebody who does not know what is this 5, what is this 3, what is this 4? Just remember this. When it is at L3, if I just press the pedal, just see. Can you see what came? See,
Yeah.
L3 seal. Can you see that?
Hmm.
But nothing came besides the watts. See, watts, the number is not shown. Saw that?
Hmm.
The watts which are there when it is at L3 is approximately 150. Okay. So that is the reason why we tell that Shearer, the current which passes through the Shearer is a very high density current, because 150 watts is a lot of current to pass through the tissue. Correct? If it is at L4, it is going to be probably 180 to 220. If it is at L5, it is going to be probably 250. Okay, so we use typically L5 over the liver and the spleen and not in the pelvic organs. But if in case you don't have this type of machine where L1, L2, L3 like that is available, the wattage setting on your seal mode, again, I'll show you the current setting because people have asked this, that how do we set it up in any generator. So on the seal mode, okay, you should have a current setting which is giving you a wattage output of close to 150 to 200. And that is when you will be able to achieve the optimal results of using the Shearer on any generator. Because we understand when people are doing freelancing, they may be exposed to a large variety of generators. And when they are exposed to a large variety of generators, they need to know the approximate wattage which needs to be done in all these situations, right? Frankly, the best way to understand as to how to use a Shearer is to actually go through some of our videos. Because when you look at some of our live surgery videos, when we are trying and speaking about it, you will realize there is virtually no lateral thermal damage. Okay. But that virtual no lateral thermal damage is not because of, me being very good at doing it. It's because of the skeletonization which I am achieving before I am using the current. In fact, if you ever see me do ureterolysis, you will hardly see me using current over the ureter. I actually end up dissecting so much away from the ureter, everything. And then when there is an adhesion, I will just go and burst. Okay. So that microscopic hand movements is something which will take probably some learning curve for each and every one of you to achieve. And once you are able to achieve that learning curve, then all these things will become a cakewalk for you. Okay. So with this, I finish my 12 to 15 minutes of speaking. But I think this lecture, I'll be more than happy to answer and demonstrate based on the questions.
Yeah. So see, how important is traction when you are using Shearer? I think
Not
that's the
Shearer.
most important thing.
In any electrosurgery, in any surgery, if your tissue is under traction, that means the contact, the surface area is stretched. So that means you are putting your electrosurgery over a small surface area. Correct? And that itself is going to be great. That itself is going to be helping you for any surgery, be it Shearer, be it harmonic, absolutely the same.
Okay. So can bipolar and Shearer be used simultaneously?
Absolutely. Absolutely,
Okay,
they can
so
be used
Dr. Samita,
simultaneously.
yeah, has asked for optimum setting for cutting and coagulation for Herbe, Allen, Shalia, Eclipse.
I told. Yes, I told. For every generator, if in case you want to use the bipolar Shearer on seal mode, that is how you are supposed to use it. The sealing current should be at least 150 watts. No matter what generator you are using.
Okay. So, traction means, is it at the tip of the prongs?
Traction is on the tissue, right?
Yeah.
Traction and counter traction is on the tissue. Once the tissue is stretched, then you apply the blades of your Shearer over that stretched tissue to get the desired outcome.
Okay. So, then there's another question, sir. You are cutting tissue with sealer paddle only or pure cut paddle?
No, sealer paddle only.
Yeah. So actually, you know what? In Allen, there are 3 foot pedals, like 3 buttons on the foot pedal. Whereas in PB, yeah. So I use both actually, both Allen and the PB. Of course, like with your modification of your instrument works very good with the PB generator, and it's simpler too. So in these situations where there is one bipolar, separate pedal, the foot switch and the cutting and then coag. So how different do you think these work? I mean, is it really required?
It's up to the manufacturer, madam. Many manufacturers will give you 3 pedals, one for seal, one for coag, and one for monopolar, one for bipolar. It's fine.
Yeah.
It's just the way it is. I mean, if you have a foot pedal like this, see, this is a foot pedal which has incorporated the bipolar mode as well as seal mode.
Yeah. So in this, what I do now, so we use the Shearer, like your Shearer also, and then the Bissinger bipolar also. And we have both like separate the wire which are connected, and we can use both the things. So as Vismai told today in the surgery, that initially using bipolar, I think is good for the beginners for sealing.
Using bipolar is good for everybody, not just beginners. The
Yeah.
problem is I don't use it because I have sort of, I have lost, I don't like to use bipolar anymore. And I try to control everything with the Shearer. And that is purely because of the, I think probably because of the volume of the cases which I end up handling. So my hand movements is very, very well controlled over that.
Yeah.
Right?
Yeah.
That may or may not be true even for me if I was not handling so many cases, honestly.
Yeah, I agree. And after how many cases do you change the?
I told today as well, I try to change after every 7 to 8. I mean, I know people who are using it for 40 cases, but I don't use it. See, I want to get the effect of this Shearer on with this smoothness, understanding? And at the moment, sometimes we do get patients who are willing to pay as well. So no problem in recurring costs for us.
Yeah, I think that's an important point where the joy of using the Shearer will wear off after some time, and I don't think we should struggle using the worn off tips and keep struggling with achieving the optimum.
Probably the plasma and the autoclaving, no, that itself will cause some damage to the blade.
Okay. And so, I mean, how do you clean that Shearer? Like, do you use a toothbrush or do you use a blade to clean it up?
It's been quite some time, but then see, it's a very simple thing how it opens. Can you see this?
Yeah.
This just opens up. Yeah, the blade is out. This guy goes separately for plasma. This is where the tissue is. I mean, this is where the jaw is. It just comes out and everything goes for plasma, right? So you can just dismantle the whole instrument like how I did probably in 5 seconds.
Yeah.
And then you can just push it for plasma, autoclave, whatever you are doing. I do plasma and I'm very, very happy with plasma because I think plasma is much more safer over these instruments as compared to autoclaving, because we really don't know how superb our autoclaves are. Are they actually maintaining the 120 and 135 degrees, what is mentioned for that stipulated time? I don't know. I'm very, very happy with the plasma. I've been using plasma since 5 years now, exclusively.
What is reason sometimes while using electro generator camera screen fluctuates?
That is due to your earthing issue.
Earthing issue, yeah. So, any advantage of LigaSure? Have you used LigaSure anytime?
Can't afford.
Okay, coming to the tip, like, I mean, Alan is now selling the gold plated ones, like the gold tip one. So you are still at the stainless steel. I mean, is there any way you're upgrading yourself or you are stuck with your steel?
No, I'm stuck. I'm stuck with these basics only.
Yeah, so poor you. Okay. I mean, is there any change in the metal if you use the lateral spread? I'm sorry. Okay,
Is there
fine.
any?
Lateral spread will be lesser if we change the metal which are used in the tip.
Lateral thermal damage is based on skeletonization and traction. It has got nothing to do with using whatever. It has got. I'll tell you one thing. How do we dissect the para-aortic region? We use monopolar current, right? Are we worried about lateral thermal damage there? No, because we are dissecting everything and then applying very fine, swift hand movements parallel to the vessels, right? And it is working beautifully well. And I personally don't think we should get carried away by such type of fear factors, that you use this and then your lateral thermal damage will be less and all these things. I don't agree to that at all.
So the another advantage with this PB generator, no? So they have the different pedal for the monopolar.
Yeah.
Monopolar, this thing. And I have seen you even operating TLH with just monopolar because your bipolar was not working.
Correct. Yeah.
Of course, a few years back. So how do you compare the bipolar? Of course, bipolar is much safer and things like that. But with monopolar, it is so smooth. It just cuts.
Yeah, because see, in open hysterectomy, when you are doing CA ovary, you are doing hysterectomy with monopolar. That time we are not thinking of all these things, no? That time we are ligating simply with Vicryl or silk, IP ligament and uterine artery at origin. So the whole organ is devascularized. And after that, if you see me doing open hysterectomy, I am using mixed and monopolar. I only use that. I don't use other instruments actually. And still the surgery goes nicely, patient goes home nicely, everything happens.
Yeah. And in this, of course, we did not speak about harmonic. But do you think is the Shearer cost effective? And do you think Shearer is the instrument that everybody should actually start investing their time to learn?
Don't know, madam. See, this is not a question which probably we should be even answering. There will be people who are not comfortable with a particular instrument and they are very comfortable with a particular instrument, right? Correct. So if somebody is comfortable, let's say with a harmonic, somebody is comfortable with a sonicization, just do it, right? Yeah. I'll tell you one thing. As you are also aware, we end up handling a lot of fistulas, lots of fistulas. Yeah. There is no difference in fistula formation rate when you use monopolar, when you use bipolar, or when you use harmonic. No difference. Totally. Okay. So and we repair fistulas with monopolar. Yeah. Which is the injury which has occurred on, let's say, bipolar or harmonic, we are repairing with monopolar, right? So I personally don't think like that, madam, and I don't think that should be a method to encourage anyone. Okay. Okay. And I think they should use what they want to use. Nothing. Correct.
I think the message today is, I think the way you're trained and the instrument that you're comfortable with and the energy source that you're comfortable with, I think people should stick to it if you're already settled with that thing. There is no need to just jump into another mode of energy source just because somebody is advocating, because it will take another few months or few more cases for you to get a grip of the new one. So there is nothing like superior, inferior in this. So I hope that everybody got the message that we were actually wanting to give. So any other questions, we will answer it on WhatsApp. So I thank everyone who joined on a Monday night. Almost like 230 people had joined.